Hello, everyone. How are you? Do you know how to identify the signs of deep vein thrombosis, DVT? In today's video, I'll show you the 5 main symptoms of this condition. Hi, my heart friend. How are you? Have you heard of DVT and its symptoms? Well, that's what we're going to talk about today. I've already published a video explaining the difference between arteries and veins. If you haven't checked it out yet, I'll leave the link up here. Before we start, have you subscribed to the channel yet? If not, take the opportunity to subscribe and activate the bell so you don't miss any updates. Your support is essential for me to continue producing useful content for all of you. Now that you've subscribed, let's get straight to the point. But after all, what is deep vein thrombosis? This condition occurs when a clot blocks a deep vein in the leg, making it difficult for blood to return to the heart. To recap, arteries. These are elastic vessels that transport blood from the heart to the body under pressure. Veins, responsible for carrying blood back to the heart. When thrombosis occurs, the passage of blood through the vein is obstructed, resulting in signs and symptoms in the affected area. Although common, affecting about 50 in every 100,000 people, DVT can leave serious consequences such as chronic venous insufficiency, causing persistent pain in the legs, swelling, wounds, and can occur at any stage of life. Do you know someone who had thrombosis in the leg and then developed a pulmonary embolism? This is more common than it seems. About 90% of cases of pulmonary thromboembolism, PE, originate from clots that formed in the deep veins of the legs. But what is PE? Pulmonary thromboembolism is basically a pulmonary infarction, a very serious condition that, in some situations, can be even more dangerous than a heart attack. This happens when a piece of the clot breaks away from the leg and travels to the pulmonary artery. DVT often goes unnoticed until it develops into PE. Therefore, recognizing the 5 main signs of thrombosis can be essential to saving lives. If you suspect you have a thrombosis, seek medical attention immediately. The faster the diagnosis, the more effective the treatment will be and the lower the risk of serious complications. The 5 main signs of deep vein thrombosis. 1. Swelling in one leg. Notice if one leg is visibly larger than the other. You can compare by placing your legs side by side or measuring with a tape measure. Differences of more than 3 centimeters can be worrying. 2. Sudden and persistent pain. It appears unexpectedly in one of the legs and tends to get worse over the days. In some cases, the pain is so intense that even touching it can be uncomfortable. If you notice pain and swelling together, seek medical attention without delay. 3. Local redness. If the swollen and painful leg is also red, go to the hospital. However, if the redness appears alone, without swelling or pain, it could be a skin infection or another condition. But if it is accompanied by other signs, do not hesitate to seek help. 4. Heat in the affected area. Just as we check for a fever by touching our forehead, place your hand over the swollen area. If you notice that it is warmer than normal, this is another classic sign of thrombosis. 5. Stiffness in the leg. Note if one leg is stiffer or more rigid than the other. This symptom, combined with swelling, pain and heat, is a strong indication of DVT. If in doubt, seek medical attention immediately. What about you? Have you ever had thrombosis, or do you know someone who has? How was the recovery? How long was the hospital stay? Many people ask me, "Doctor, Can anyone develop thrombosis? The answer is yes. Although anyone is subject to it, some factors increase the risk. Main risk factors: habits and living conditions. Smoking, staying in bed for long periods, and uncontrolled hypertension. Genetic factors: protein C and S deficiency, and other hereditary coagulation disorders. Acquired factors: long-term surgeries, long trips, plane, bus or car, trauma or infections, use of certain intravenous medications, pregnancy, and use of contraceptives, especially in women over 35 and smokers. Why do pregnancy and contraceptives increase the risk? During pregnancy and with the use of hormones, the body enters a state of hypercoagulation to prevent excessive bleeding. However, this mechanism also facilitates the formation of clots. It is worth remembering that, after the age of 40, this risk practically doubles every decade, especially in women who smoke or take hormone therapy. If you fit into any of these risk groups, schedule an appointment with your doctor to discuss the best ways to prevent it. Beware of symptoms that may progress to PE. If you experience sudden shortness of breath, go to the emergency room immediately. This symptom may indicate conditions such as pneumonia, asthma, heart attack, COVID-19, or even thrombosis that has evolved into a pulmonary embolism, a medical emergency that requires quick action. Final message: if you like this content, like the video and share it with your friends. Quality information can save lives. A big hug and see you in the next video.